joining to this podcast on living with hypothyroidism. Thyroid hormone is very, very important, and dysfunction of thyroid affects about 8% of total population. About 20 million people in the United States are living with thyroid problems. It's a very common problem. There are a lot of confusion around it, especially which kind of blood test needs to be done, which medications and diet, exercise, and importance of other medication which you might be taking, weight gain and mental health. We will take all these topics. We will build a narrative where we will start with what thyroid gland is, where it is located, what kind of hormone it produces, and how body controls those hormones, what they do in the body, and then finally we will take up the diseases. In the end, we will take common questions. Let's begin our discussion about thyroid. Thyroid gland is located in the neck above your voice box. It's like a butterfly shape. It has two lobes which are connected together. This gland is controlled by two control centers in the brain and also what our body does to thyroid hormones. If I could increase awareness that 20 million people who are totally unaware that they may have thyroid problem, dispel some myths, support you guys by answering the question, and hopefully develop a community and have some practical tips, I think I did my job, and my hope is that you feel empowered. What is thyroid hormone? This gland produces T4, the other one is T3. Thyroid gland also produces two more hormones. Parathyroid gland, which is embedded into the thyroid gland, it produces parathyroid hormone. Parafollicular cells produce hormone. Your PTH and calcitonin control calcium and in turn control your bone health, your muscle contractions. Hypothalamus is a master part of the brain which is continuously 24-hour basis sensing our internal environment, what is going on inside the body, and it is getting input from outside environment through our senses, and it balances both internal and external environment. When it comes to thyroid, hypothalamus produces a chemical which we call thyroid releasing hormone. That goes to another gland in the brain which is pituitary gland, and pituitary gland produces a hormone called TSH. This TSH goes to your thyroid gland and you produce two hormones, T4 and T3. Your gland produces about 80 to 95% of T4 and only 5 to 10% is produced in the form of T3. Biologically, T3 is the active hormone and T4 needs to be converted into T3. The level of T3 is sensed by your pituitary gland and it has a negative feedback. When T3 level goes up, it shuts down pituitary gland to produce TSH, so our T4 production decreases. When the levels are needed, a releasing hormone from hypothalamus going to pituitary, releasing TSH, and then this whole cascade is controlled. It's a beautiful symphony on 24-hour basis. It's a delicate mechanism from hypothalamus to pituitary gland to your thyroid gland and your body. Anywhere at 4 places, if something goes wrong, we could have problem with the thyroid, whether it's overproduction or underproduction. Primarily 90 to 95% of the patients who have thyroid problem, they have hypothyroidism, meaning it's underacting thyroidism. There is not a metabolic process which is not controlled by thyroid. We will start with proteins. Your total protein synthesis, whether it's the production of new proteins or rejuvenating the older proteins, you need thyroid hormone. Carbohydrates. Thyroid hormone directly affects glycogenolysis, which is breaking of the glycogen into glucose. You might have seen that if you are a diabetic and sometime you don't eat and your sugar still goes up, that is the glycogenolysis, that your body is breaking your glycogen into glucose and trying to keep everything going up. Your cholesterol definitely increases. If your thyroid hormone is under, your cholesterol will go up. And you might have seen that if you have a hypothyroidism, your doctor will tell on your blood work, your bad cholesterol is high. You need thyroid hormone so that bad cholesterol is picked up by your liver and used for different processes or eliminated from the body. In the absence of thyroid hormone, you will have difficulty in clearing your cholesterol and your bad cholesterol will go high. Body needs X number of Fahrenheit of temperature to work properly. Our human body works perfect around 98.3 to 98.4 Fahrenheit. The hormone which regulates your temperature, that comes from thyroid hormone. If your thyroid hormone is not there, your body will not be able to produce enough heat from carbohydrate, fat, and protein metabolism. You will always be feeling cold, and when we do the symptoms, that is one of the symptoms, and you will understand why this thing happens. Your heart is a muscle. It does two things. It has to squeeze blood so that it keeps up the circulation. Function of heart depends on heart rate and what is the strength of the muscle. You need thyroid hormone for increasing the squeeze or the strength of heart muscle and also for the rate. Growth and development. When you are young and developing, you need adequate amount of thyroid hormone so that your body can grow, your bones can grow, your muscles can grow. In the absence of thyroid hormone, you will not be able to reach your full potential and full maturity of the body. Brain. Thyroid hormone affects your emotions and memory. If your thyroid hormone is less, you will be constipated, and if your thyroid gland is overproducing, then you will have diarrhea. It's a very intricately involved bone health. Reproductive health. In case of ladies, if you have thyroid underacting, you will have irregular periods. You may have increased or low menstrual flow, and it can be very complicated. Our body is magical. We are made about 60 to 90 trillion cells. In every cell, there are about 10,000 chemical reactions happening per minute. Can you look at the vastness? 60 to 90 trillion cells and 10,000 reactions per minute. And it happens perfectly in 99% of the cases. And whenever these chemical factory or chemical reactions are not proper, that is the time some kind of a disease state arises. Our hypothalamus senses our internal environment and external environment. It sends a chemical which we call thyroid releasing hormone, which goes to pituitary gland, that produces TSH. Then the TSH goes to your thyroid gland, and thyroid gland produces T4 and T3. Your brain senses the physiological level of T3, which is the active form. Then it shuts down this cascade and the level goes down, and based on the need again, things start coming back again online. When you are looking at thyroid, you must look thyroid from 4 angles. Problem could be in hypothalamus, pituitary gland, your thyroid itself, and the body. Whenever there is a problem in the thyroid gland, we call it primary problem, because thyroid is the gland which is primarily producing these two hormones, T3 and T4. Hypothyroidism. about more than 90% of you have autoimmune thyroiditis or Hashimoto thyroiditis. Your immune system produces TPO and TBG antibodies that destroy your cells, and your thyroid cells are not able to produce T4 and T3. You develop hypothyroidism. Deficiency of iodine. It is not a problem in the United States, but in India and certain other parts of the world, we have seen patients who develop underacting thyroid because there is a deficiency of iodine. If unfortunately you have a tumor of thyroid or thyroid is exposed to radiation, you may develop hypothyroidism. If you need surgery for tumor or overacting thyroid, you could develop hypothyroidism. For most practical purposes, it will be autoimmune. Your thyroid will not be producing enough hormone, and that will lead to low level of T4 and T3, and your everything will slow down. If you develop hypothyroidism, what are the symptoms you will develop? You will feel very tired. You will have mental fog. You will be constipated, difficulty with your menstrual periods. Some patients become very depressed. They cannot focus. They have memory problems. You could develop peripheral neuropathy. These symptoms are very vague. There is not a one symptom which is very specific for thyroid problem. It becomes very difficult initially for patients to understand and recognize it. We as physicians, every time we do the blood work, we will check your thyroid hormone. If you have any of these symptoms, please make sure you tell us. It's very important to keep up with your physicals. Symptoms of hypothyroidism are unusual fatigue, little bit of weight gain, you feel cold all the time, you're constipated, you're depressed, you're losing hair, menstrual irregularities, and vague muscle pains. When we examine you, we find your skin is dry, cold, little bit of swelling, your heart rate will be slow, and then when we do your tendon reflexes, they will be slow. How do we diagnose it? Out of the 4 places which I mentioned, starting from your hypothalamus to pituitary gland to your thyroid gland and peripheral conversion in the body, the most sensitive test is a TSH. Remember, even though your thyroid gland produces about 90% of thyroid hormone in the form of T4, for it to be chemically active, it needs to be converted into T3. If all your hormone by the thyroid is produced in the form of T3, you will be on auto gear all the time. You will not be able to relax. You will be agitated, irritable. You won't be able to focus. You will have diarrhea. You will have palpitations. Muscles will be weak. Bones will be weak. And that's exactly happen in a condition which is called hyperthyroidism, which is overacting of the thyroid. The evolution has created this trick. T4 is delivered to them, and based on their needs, they convert through enzyme deiodinase T4 into T3, so that our body is not bombarded with metabolically active hormone all the time. A kind of a check and balance system. Everything which happens in the body has a reason and purpose. When the level of active hormone goes down, your pituitary gland responds very quickly. That is why whenever we are looking for any kind of thyroid problem, whether it's an over-functioning thyroid gland or underacting thyroid gland, which is hypothyroidism, TSH is the most important test. Most of the time, if we are screening you for thyroid problem, then you will need only TSH. If your TSH level is good, case is closed, you do not have any thyroid problem. But if your TSH is abnormal, then we will explore further. Hypothyroidism is primarily due to autoimmune disease, which is Hashimoto thyroiditis, where your thyroid gland cells are destroyed and is not producing. Your pituitary is seeing that you don't have the active hormone. So it's sending a lot of impulses down to your thyroid gland to produce more. Your TSH level will be very high. Your free T3 and free T4, they both will be low, and total T4 will be low. But once we are treating you, say for example, you do have hypothyroidism and we are giving you medication and we following your level, how much medication you need, that is the time the level of T4 is important. Very rarely we need the antibody levels because for all practical purposes, it is due to autoimmune disorder. People read on the internet when they get diagnosed with hypothyroidism that they want to know their TPO antibody or TPG antibodies. Even if you have, no matter how high level of T antibodies is, that does not interfere with your management. You will not be changing or doing anything based on that level. So that's why we don't do it. It's not needed. But if somebody insists, those can be done. Sometimes we do the ultrasound and the nuclear scan. There will be some accessory blood tests which will get done. As I said, your cholesterol will be high, and then muscle marker, creatine kinase can be high, and a lot of electrolyte abnormalities, especially sodium, that can be low. I want you to keep in context thyroid hormone is very important, and every organ system of the body needs thyroid hormone. It is absolutely needed to maintain your basal metabolic rate and your temperature that your body can function properly. Remember, your thyroid gland is producing about 90% in the form of T4, and it needs to be converted to T3 based on your needs. If there is anything which blocks this conversion of T4 into T3, that will also give you the symptoms of hypothyroidism. There are certain dietary patterns, if we develop any of those, that will interfere with the conversion. What is the treatment? Where we stand in the spectrum? Many of our patients, when we do the blood work, their TSH level is high, but their T4 and T3 level is with the normal limit. It's not very uncommon scenario. It happens about 10 to 20% of the time. We call it subclinical hypothyroidism. Your thyroid gland is not completely gone, but it is failing, and there is nothing which we could do to prevent it, to stop it. This is an autoimmune process which will happen regardless of what we want to do. In those conditions, we don't give you thyroid hormone except in one condition: if you're pregnant. Pregnancy increases the demand for thyroid hormone. Unless you're pregnant, we do not give you any thyroid hormone replacement therapy till your thyroid hormone really goes down. Your total T4 and free T3 has not gone significantly. If we start giving you from outside, you will develop all the symptoms of hyperthyroidism, and that is what we want to avoid. Hypothyroidism is very common and very complicated, but we don't get acute problems because if your thyroid hormone is high, it can put you in a lot of medical problems, and the most feared one is psychosis, where you go feel crazy in the brain, and then your heart rate could go very fast and irregular, the condition called atrial fibrillation, and we many times end up admitting those patients with heart failure and multiple other complications. We do not need to start treating subclinical hypothyroidism unless you're pregnant. We start levothyroxine or Synthroid. Both these medications basically are T4 analog. We are not giving you T3, we are giving you T4. We depend on the wisdom of our body, the way it normally does. It converts T4, which is circulating, based on its needs from T4 to T3. I think we should discuss Armour thyroid. They take animal's thyroid, dry it, powder it, put it in a capsule and give it to you. Remember, whether it's a human thyroid or animal thyroid. It produces two hormones, T4 and T3. Because it's producing both these hormones, when you take these medications, you are giving yourself both T4 and T3, and you are bypassing this human body's wisdom to control each mechanism. Those patients many times end up having a lot of cardiac symptoms regarding irregular fast heart rates, heart failures. Each animal is different and the content is very different. Sometimes you may get supratherapeutic doses in these dry powdered so-called natural thyroid hormone replacement versus the prescription pills. I had a very difficult experience last week with one of our patients, and she was elderly frail lady who already had irregular heartbeat, and she was on medications, and she developed hypothyroidism, and she insisted that she wants to take natural. She will not listen to me. She changed her doctor and then eventually end up in a hospital, and then I saw her back. This is a sad story that this circle happened. If she would have listened and not gotten this natural thyroid, she would have not gotten T3. We all should trust our body to control our chemical processes. Let's take levothyroxine and synthroid in detail. Levothyroxine is a generic medication and synthroid is a branded medication. There is no evidence that branded medication is more superior than the generic, but the cost difference is almost 100 times. A 1 month supply of levothyroxine costs $3 to $4, whereas synthroid branded will cost you probably $150 to $200. We control this dose very meticulously. When you develop hypothyroidism, your physician will calculate the dose, they will give you medication, and then they will do blood work on a regular basis. When we're initiating the treatment, if I start you on thyroid medication today, it will take about 3 to 4 weeks your body to equilibrate, and then we'll do the blood work again. We'll follow your T3, T4 level and your TSH level, and we will go up and down. If your levels are not controlled quickly, you need to be patient, because your physician is trying not to give you too much of thyroid hormone, because if they do, then they can put you on irregular heartbeat and heart failure. Patience is the key, and titrate slowly based on your needs. What are the things as a patient you could do to improve your thyroid hormone? Exercise, moderate activity, whether it's bicycling, swimming, walking at a faster pace, they all lead to making your thyroid hormone work better. Most of the effects are possibly like from conversion from T4 to T3, which is circulating in the body, and it will help you to keep your metabolism going, and it helps to regulate your thyroid hormone. Sleep 7 to 9 hours is also very, very important. Remember, if your thyroid is over or under, both can lead to a lot of emotional stress, memory loss, and lack of focus and attention. There are certain foods which you need to know. Certain foods, they interfere with the conversion of thyroid from T4 to T3. And we call those medications goitrogenic, meaning those medications are not letting the natural body's wisdom to work and lead to development of hypothyroidism. They interfere with the iodine up. There are certain products which lead also to deactivating the enzyme which we need to convert T4 to T3. Those are isoflavones and thiocyanates, and a lot of grains have phytates which all interfere with the iodine mechanism or the enzyme. But there are foods, if you eat them, they are very high or rich source of iodine, and they prevent hypothyroidism. The foods which you should eat in order to improve your thyroid health, or what we could say the thyroid diet, it should be seaweed, which is very rich in iodine. Fish, especially mackerel and salmon, they are very rich in iodine and omega-3 fatty acids. Dairy, all dairy products are fortified. They are a very rich source of iodine. Eggs have selenium, zinc, and iodine. They are very good for your thyroid health. Antioxidants like berries, strawberries, blueberries, raspberries, they are very rich in iodine. Nuts and seeds, especially the almonds or Brazilian nut, they are very high in selenium, and they also will help you to improve your thyroid health. Vegetables, especially cruciferous vegetables, in moderation. They go in both ways. They have certain chemicals which will block the conversion of T4 to T3 by interfering with the iodine. Certain foods you must avoid if you have hypothyroidism. Anything with soy interferes with thyroid hormone production. Cabbage, the cruciferous family of vegetables, if you eat too much of cabbage, that can interfere with your thyroid functions. Gluten, especially if you have celiac disease. Sugary drinks, all kind of sodas, any liquid which is full of simple sugar directly interferes with your thyroid. Processed meats, they are very high in sodium and other chemicals, preservatives, which interfere with your thyroid hormone. You need omega-3 fatty acids and iodine to work properly when it comes to fat, but if you consume too much of fat, it will interfere with your thyroid hormone. Coffee directly interferes with the thyroid hormone. The instructions which your pharmacist will give, if you're taking thyroid hormone, you need to take it empty stomach at least 30 minutes before you eat, and then they recommend you shouldn't take anything or eat anything for 30 minutes. There is one fruit which is endemic in India. We call it jamun. Actually, I brought it from India and I have it at our home, and also in our Sebring office we have this jamun tree. I hope this year we will have some fruits. It goes with the English name Syzygium cuminis. This jamun tree is a very, very rich source of iodine. We also sometimes call black plum or Indian blackberry. When we have that fruit, anybody who has hypothyroidism, they could try. But I felt like that we should mention jamun is very commonly consumed, especially by the young ladies, because it provides a ton of iodine. Then certain exercises. There is one exercise which is a yogic techniques. They call the locks. In yogic tradition, they do a lot of breathing exercises. There is one particular exercise I can demonstrate to you, in which what you do is you take a deep breath and then you tuck your chin in and you hold your breath as long as you can, and you're squeezing your stomach muscle. It increases thyroid circulation and you release a lot of thyroid hormone. I was very skeptical about this technique, and I have one of yogic teacher whom I meet every time I go to India to see my dad, and he always insists on doing these locks. In the yogic tradition, this exercise, which is called Jalandhar Bandha, or I will say throat lock, it is shown to help and improve your thyroid function. So what we do in this one is we breathe in as much we could, then we tuck our chin in and we squeeze our stomach muscles and we keep it there. We cannot hold it anymore. And then we release your neck and you breathe normal. They claim, and the literature supports it, that if you do this exercise about 10 times a day, it has shown to improve your thyroid function. I wanted to make sure I mentioned this two techniques. One is the jamun, the fruit, which is very commonly consumed in India, and then this throat lock, which also has been very much consistently done by anybody who has hypothyroidism. Hypothyroidism and mental health. In seniors, hypothyroidism, as we age in 50s and 60s, our thyroid start failing due to different reasons. Most common is autoimmune. So we go subclinical hypothyroidism, then fully hypothyroidism, tiredness, weakness, feeling cold. We all tend to blame it on aging. But same symptoms happen due to hypothyroidism. If you develop hypothyroidism, especially in seniors, you have a lot of consequences. You are weak and tired and fragile anyway, and thyroid can really complicate the issue. In elderly, screening for hypothyroidism is a standard protocol. In hypothyroidism, your brain cells do not fire at a speed they should. Everything is slowed down. All the neurotransmitters, the way one cell connects to the another or talk to each other, the synthesis of those neurotransmitters goes down. We lose brain cells all the time, and stem cells replace the brain cells. They are not getting replaced. So losing neurons, whatever is left, they are not firing at a faster pace, and then they cannot communicate because the neurotransmitters are not produced. That leads to a lot of emotional symptoms, leading to depression, and then cognitively, because your brain's nerve cells are not firing, your intellectual functions slow down, you lack attention, you cannot concentrate, you start losing memory, you cannot recall. All these things lead to pseudo dementia. Good part is, once we recognize it, if we replace your thyroid hormone, bring it to the therapeutic level, all these functions do improve. In hypothyroidism, your metabolism slows down. In hyperthyroidism, your metabolism speeds up. In hypothyroidism, you gain some weight. But in case of hyperthyroidism, we lose weight. In case of hypothyroidism, our skin becomes dry, our hair and nail become very fragile, and they are thick. In case of hypothyroidism, you will be constipation. In case of hypothyroidism, you are feeling cold all the time. In case of hyperthyroidism, you will be sweating all the time. You will be depressed in hypothyroidism, and you will be anxious and nervous and irritable if it's hyperthyroidism. Sleep, hypothyroidism is iffy with the sleep. But if you have hyperthyroidism, you will have difficulty in sleeping. We need to know these symptoms. One of the young ladies, when they got diagnosed hypothyroidism, and they blame all their weight gain to hypothyroidism. Even in severe cases, the average weight gain on the worst case scenario is not more than 8 to 10 pounds. Even if severely hypothyroid, your weight gain is 8 to 10 pounds. Anything beyond that weight, diet and exercise rather than thyroid. Next thing which I want to bring it to your attention is certain medications which you might be taking, and they may lead to hypothyroidism. When it comes to heart, there is one very common medication, amiodarone. It's a life-saving drug. Whenever you have an irregular heartbeat like atrial fibrillation, or after bypass surgeries, or any kind of ventricular arrhythmias, this amiodarone can most of the time will lead to hypothyroidism, but it can overactivate the thyroid too. Medication which work on the brain, most common is anti-seizure medications, and then old bipolar medication, lithium, they also can interfere with your thyroid hormone. If you have other autoimmune disease like rheumatoid arthritis, lupus, scleroderma, or psoriasis, and you may be on steroids, will also interfere with your thyroid functions. certain antibiotics and also the anti-TB medication, certain beta blockers which we use for essential tremors and liver problem that can do that. Medications can interfere with your thyroid functions. Anything which contain estrogen can interfere. How to live with it? The gist of the problem is that you have a hypothyroidism. What do you need to? There are two messages I have for you. Number one, monitor your symptoms. If you are on thyroid medication and you're still feeling tired, you're still feeling constipated, feeling cold, you have swelling, you're not adequately treated. Know your symptoms. That's one. Second, know your blood test. When you go these days, the most beautiful part is every doctor's office will give you access to your patient portal. We make very concerted effort every day so that you have your information available 24-hour basis. But unfortunately, people are not accessing it and you are not using it to your advantage. If you have a hypothyroidism, know your symptoms. Make sure you know your labs. And two labs you need to understand: your TSH level and your T4 level. If you know those two levels, you will be able to help your physician manage you better. If your symptoms are not controlled, we will follow your blood work, we will adjust your medications. Remember, avoiding those foods. It is important that you start exercising. Ask us questions. Many times people just come to our office, but they're not active participants. They want you are educated about your disease process, and you should be able to ask intelligent questions. When it comes to hypothyroidism, there are two messages: know your symptoms and know your labs. Then comes a lot of myths. First was, extra hormone replacement will give me weight loss. No, it does not. Extra hormone replacement does not help. It may give you palpitations, it may give you other symptoms. You should not take extra hormone. It is a myth. Next myth: can I manage my hypothyroidism with a diet alone? The answer is no. Next myth is gluten-free diet can improve Hashimoto's thyroiditis. That is false. Gluten has nothing to do with Hashimoto thyroiditis. It has to do everything to do with celiac. Next is natural supplements are more potent than prescription medication and they are more effective. That is completely false. Remember, the natural supplements contain T3, they also contain T4. And the concentration or amount of T3 and T4 is very different in different preparations. They can lead to complications. Insist on taking prescription medication rather than taking natural supplements, because natural supplements are not controlled. Next is, hypothyroidism always causes weight gain. Absolutely not. The maximum weight gain in a worse condition is 8 to 10 pounds. It does not lead to weight gain most of the time, and most of the weight gain is water weight. Next myth is you diagnose hypothyroidism based on symptoms alone. Symptoms are very vague. These symptoms overlap with many diseases. You need symptoms plus blood tests. Hypothyroidism only affects metabolism. No, metabolism is one part. It affects all organ system. You should stop taking thyroid medication if you feel better. No, that means you need to continue the medication. If you are having symptoms, this means you are not adequately replaced. But when you are adequately replaced, then you should continue taking medication and you should not stop it. Then next question always comes in is, if I'm taking thyroid medication, then I don't have to do anything. No, that's not true. If you have been taking thyroid medication, you must Continue taking medication and monitoring yourself, and based on your metabolic needs, you may need a different amount at different stages of your life. Now we enter the next part of our podcast is frequently asked questions. What are the primary causes of hypothyroidism? Number one reason for hypothyroidism is autoimmune, which is Hashimoto's thyroiditis. Your body starts producing antibodies which destroy thyroid cells, which leads to decreased level of thyroid hormone. How does hypothyroidism affect metabolism? It slows everything. It slows our basic metabolic rate. It slows all chemical processes, including carbohydrate, fat, and protein metabolism, and every organ system slows down, and it leads to dysfunction of all of them. What are the common symptoms of hypothyroidism? Most common symptom is fatigue, tiredness, weight gain, constipation, and cold tolerance. What treatment options are available for hypothyroidism? Most common treatment is taking medications, supplemental exercises, supplemental dietary interventions. They all can help you. Foods to avoid, foods to take, and yogic exercises, they all can help you, but you will always need medication. What are the complications of untreated hypothyroidism? Most feared is our mental health. It can lead to depression, loss of memory. Physically, you will be weak, tired, your heart rate will be slow. There is a lot of complication in the conducting system of the heart can happen. You could accumulate fluid around your heart. You will be constipated. Your fluid and electrolyte balance will be totally off. How does hypothyroidism differ from hyperthyroidism? Everything which we talked about, whether it's your metabolism, your gut, your heart, your brain, hypothyroidism slows everything, hyperthyroidism speeds up everything. Can hypothyroidism be prevented? I don't think so, because it is a draw of luck. It's an autoimmune disease and you don't have a control over that. But you could be proactive in getting yourself screened, knowing what's going on, because this is very, very helpful to know the symptoms. If you screen yourself, you are properly treated and you never get any complications. What dietary changes are recommended for people with hypothyroidism? Any medication which interferes with either production of thyroid hormone or conversion from T4 to T3 should be avoided. Those are cabbage, soy, and any food which is high in phytates, isoflavones should be avoided. Any medication or a food which increases iodine, whether it's fruits like jamun or fish, quality meat, all these foods can help to improve the availability of iodine in the body and lead to improvement of thyroid functions. Hypothyroidism at the worst case can lead to 8 to 10 pounds of weight gain, and there is hardly anything beyond that. 8 to 10 pounds could be, I'm not saying for certain, could be due to hypothyroidism. Whereas weight loss in hyperthyroidism could be astronomical. I had a patient last week, she has lost more than 45 pounds with hyperthyroidism, and that is a very serious disease. A lot of things goes wrong with that in that body. Are there any specific consideration for hypothyroidism in men and women? Hypothyroidism happens more in women than men. That's why we screen everybody. But as we age, more and more men develop hypothyroidism. What is the role of autoimmune disease and hypothyroidism? About 90%. Hashimoto thyroiditis is the most common reason for autoimmune disorder. How does hypothyroidism affect mental health? It slows down everything in your brain. Brain cells cannot process the information, they don't fire properly, they don't communicate properly. That leads to depression, loss of attention, memory loss, and poor recall. What are the long-term effects of hypothyroidism? From slowing your mental processes, your heart, your gut, your muscle, your bone, name any organ system will be affected. And you must get yourself screened and you must take the medication if you have hypothyroidism. This is a hormone which impacts every organ system in the body. So if it can impact everything, it can lead to all the complications in the world. There is not an organ system which is not affected by thyroid hormone. We should do everything to get ourselves properly screened and taking proper treatment. Do we need to go to endocrinologist if I have a hypothyroidism? I truly believe your family physician or internal medicine doctor is fully equipped to take care of your thyroid problem. I do not believe you need endocrinologist to treat it. Finding endocrinologists in most of the communities is very difficult. Number two, it's a very simple disease. So long as you're willing to talk to your primary care physician, you are willing to monitor the blood work. In nutshell, let's put it together. Hypothyroidism is a very common disease. Thyroid hormone affects every organ system in the body, including your metabolism. There are two controls in the brain, hypothalamus and pituitary gland, thyroid gland, and then eventually T4 is going to be converted into T3. Things can go wrong at multiple places, but most common is Hashimoto thyroiditis. I wanted to make sure take prescription medication and not to take the natural supplements because they are not controlled. They contain both T3 and T4. Nobody needs these both hormones. Let your body's magic or intelligence work and count on that part. Avoid certain foods if you have a thyroid problem. Know your symptoms, know your blood work. I hope this was helpful. Thank you for paying attention, and please do not forget to like, share, and subscribe. Thank you very much.